We all want to improve as osteopaths, as practitioners. That's kind of pretty obvious. But whether you've been out a week or 40 years, I think it's an area that we tend to struggle with a little bit. And so I wanted to share with you something today that happened to me when I first graduated, and I kind of stumbled on it by accident. But it really helped me in terms of my practice and in terms of improving. So I'm hoping if I share it with you, whether you've been out a week or 40 years, it'll also help you as well. And what happened was, when I was in university, I was going to say really good at necks and shoulders, but I was in university, so I was okay at necks and shoulders, but I was really poor at low backs. It was something I really struggled with. And I worked hard on that because, you know, you're meant to find your weakness and work hard on them. I worked hard on that, but it didn't really improve much. And then when I graduated, I went to New Zealand and I started working there. As you can imagine, I saw a lot of low back patients. And so that was a bit of a struggle. So 3 or 4 months in, those first 3 or 4 months were a really dark period for me. I moved to a new country, I didn't know anyone at all, and I was struggling a little bit in this area, which was a core skill. And I'm a bit of a perfectionist, and that kind of helped me here because I wasn't going to settle for just as it is and try to get better gradually. And so one day I sat down and was like, right, this is not working, I've got to change this. This area of the low back is weak for me. And so I looked at it, and I looked at the things I was doing that weren't helping me. And lumbar rolls. I am useless at lumbar rolls. The thing when you do sideline, you get them sideline and you bring them into flexion and extension to try and feel what's going on in the lumbars. Working out what's going on with rotation and side bending. I remember in college, this vertebra is side bent, this was rotated. I couldn't feel that. So if you just graduate and you can't feel it, look, it's all right. There's no problem. There's a lot of us that feel that way. So I identified those things, and then this is where the key was. I didn't then try and improve them more. I just dropped them. I cut them out completely. And what it did is it did 2 brilliant things for me. Well, 3 things. One, it improved my confidence, so I wasn't doing something where I wasn't getting benefit from and wasn't, improving what I was feeling. The second one is it meant I had more time to do something else. So I wasn't spending all this time, wasting this time on things where I still didn't know what the patient was going on. And the third thing, and probably the most crucial thing, was without doing those things, I had to do something else. I seriously had to do something else. And so it forced me to be creative. It forced me to find what worked for me. And that was the kind of the change. Now, this isn't a glory story where one day I decided to do that and then the next day suddenly I was brilliant at low backs. No, that doesn't happen. But what happened was I started to get better at low backs. And over the next 6 months, I've improved vastly through them. And now, even though I'm good at necks and shoulders, low backs are the best thing for me. I think that's my best area, even though it was my weakest. And it was because I identified what wasn't working for me and I killed it. And so there's the story, and it's good to teach through stories because people identify for that, and rather than just being technical. But the summary of that story is what I'd like you to do to move your practice forward. Well, you've been out a week or out 40 years, because if you're out 40 years, I bet you're doing stuff that isn't serving you because you've got into habits of doing it. I'd like you to identify an area that's weak for you, and then I want you to drill down and see what you're doing in there that you aren't getting value for money, aren't getting bang for your buck, and you can spend that 1 minute or 2 minutes or 5 minutes doing something else. And then be brave enough to drop those things, because it will force you to do something else and you'll be creative. I saw someone post on here the other day, how can they be more intuitive, follow their intuition. This is how you do it. This is one way, is you force yourself into that. It's almost like you're going to go into a flow state. And that's what happened with me. I had to go into a flow state and start to find something under the pressure of not having the old stuff to fall back on. Now, this is hopefully a good video for you, but if you don't do the next step, then all it'll be is a video that was entertaining. You must make yourself accountable. So how are you going to make yourself accountable so in 3-4 days time you're doing this and you haven't forgotten this video? And the way you do that is you simply tell someone what you're going to do. Whether that's your wife, whether that's your husband, your partner, whether it's your bestie. Tell as many people as you can actually. Right, what I'm going to do, I'm going to do this thing to help myself get better as a practitioner. I'm going to find an area that's weak, I'm going to identify what I do within that, and then I'm going to stop doing those. And then if you tell enough people, then they will keep asking you, how are you going with that thing? Yeah, and you're going to be forced to do that. And I've done this a lot in my life. When I left university, I wanted to go traveling. And so I spent 6 months before that telling everyone I was going to do that. And then when all my mates dropped out, I had to go, even though I was on my own and I was scared, because it was too embarrassing not to do anything else, not to go. And it worked really well for me. So I'm hoping this video was of use to you. If you'd like to see more of those, I'm more than happy to give and to do these Facebook Lives. They're a little bit nerve-wracking because you've got to get up there and hit it and make it work first time, but I'm more than happy to share in lots of different areas in terms of improving what we do with practitioners, but only of course if it's of benefit to you. So if it's benefit to you, just let me know in the comments. Do another one, go for it, or stop, don't like it. And also if you have a particular topic that you're struggling with, you know, ask me. I'm more than happy. I can talk endlessly about osteopathy and about treating patients. So thanks for listening.